Today we will continue a journey on the subject of mental health. And since January started this year, I've had a number of conversations. Recently, I had a conversation with Dan Simons from Founding Farmers, and that's actually why today's guest is here today, because actually there's a connection there. We'll come back to that. But yeah, I connected with Feri. She talked about that she really wanted to talk with me about a platform that was all about how actually people could get access or make it accessible to everyone to get help when they need it, especially when they're going through troubled times. And of course, we're going to talk a bit about the platform today, but we're more going to talk about the why and actually some of the challenges that Feri has seen people come to the platform with and how that's helping people and so on. So welcome to the show, Feri. We'd had a couple of conversations before we're sitting here, but I'm extremely excited about us having this conversation today.
Thank you. Lovely to be here. I appreciate your time.
And Feri, just for the audience's sake, talk a bit about your journey, because there's always a journey to any kind of entrepreneurial venture in a way, because you had done lots of things before you did this platform.
So yes, I have been involved in medical industry for over 20 years. Before that, I worked for corporate America, where I learned a lot, great experience, but I didn't feel I belonged there. So I joined a private practice and learned the ins and outs of medical industry. So, and I, realized that reputation is really the most important thing, especially when it comes to, presenting yourself. Now we have all these review this, review that, Yelp, and, Google reviews. But back then we really didn't have, any of these resources, and word of mouth was very important. So we did everything and anything we can do to give our patients a good experience, a feel-good experience. And when they left our practice, our clinic, they would go and tell their friends, their family, and, we didn't do any marketing. It was just word of mouth. And the practice grew from, seeing 1-2 patients to 100 patients now. And it was a great journey for me. I learned a lot. And I'm still involved in the clinical world. But in year 2020, I myself lost my father. And I started seeking for, professional help. I wanted to really talk to somebody. I was going through grief process. We all go through different challenges in our lives, whether it's our children, our health, our spouse's health, our friends, our family. But when somebody who is really important to you, it's, protects you, is one of those grandiose characters, passes away, I myself felt lost. And grieving process was very difficult for me. So I needed help. I realized that I need help. And I couldn't go through it by myself. And my father was a, scientist. He loved nature. He was a botanical scientist. So he studied flowers and plants, and he loved nature. And he taught all of us to love nature and find healing there, find your, purpose. So I have 3 siblings, and we were all involved in, planting, hiking. We loved nature, all of us. So he taught us that. And then suddenly he was gone. And I felt lost. And so my mother is a pharmacist, and they both are in science. So we were also taught the importance of science and, to depend on science. So they met in Germany. They had my mother is Turkish, my father is Persian, and they met in Germany in early 1960s, and they were hippies. Muslim hippies.
Mm.
So, and, they did really well. They did really well. They learned another language, they learned another culture, and they taught us to be diverse, the importance of different cultures, the importance of how to connect. It's so important. And that's one thing us humans and all mammals and trees and this whole planet, we're connected. We're connected to one another. And so that's what my father and my mother taught me. And so after he passed, I looked for psychologists around me. And being in the medical industry, I thought like, oh, it's going to be so easy. I'll find someone in a, heartbeat. But no, I called all the primary care doctors that we work with, and they gave me all these names, and I called and called. Couldn't find anyone because remember, this was after pandemic 2021, and everybody's booked. So I started looking for global products, other countries, and I found a perfect match for myself. And we continued to this day. I'm still talking to her, and she helped me. She put me on the right path, and I'm like, okay, I'm sure there are a lot of people like me who are looking for guidance. And what can I do about this? This was my purpose. What can I do about this? I have all this knowledge. I have a computer science degree. I have an MBA. I have 20 plus years of medical industry knowledge, 10 years of, corporate America knowledge. How can I put all of these together and create a product to help others that are in my situation? Not, in my situation, I'm post pandemic, we were seeing the suicide rate is, out of control, especially in minority groups. In minority groups, suicide rate was extremely high in United States. And then Deloitte did a study in Canada, and it was mental health affects $50 billion every year. It affects the economy, and people cannot just put themselves together to go to work. And that, adds to the bottom line. It adds, So what can we do as the citizens of this world? What can we all do? We need to, come up with solutions like we always do, come up with quick solutions, accessible solutions, and affordable solutions. Because, mental health is very expensive. Not everybody has the means to pay $200-300 per session. So my product is $58. I made it affordable. I found the right resources. I found the right, technology, and I put my heart and soul in it. And I wanted to bring a product that is easily accessible, affordable, and delivers what it promises. It's a comprehensive approach to wellness, not just mental health. We have mindfulness resources, and I believe it's a full package. I mean, you need to look at every angle of the problem, and and continuously provide resources. Not that 50-minute. That 50-minute gives you the roadmap, but then what do you do rest of the week? And then, you need resources. You need to have a guiding platform that you can always tap into and, read blogs or listen to the mindfulness, resources that we present to our clients. So that was my idea, to bring in a resource that people can use and take advantage of. Yeah.
And it's very interesting with is the platform MeTime Healing, where you go in and you can maybe explain a bit more in detail how it works. But For myself, or just, and I think it maybe be interesting for the audience as well. Think, why are we talking about this? Because time is scarce, and also a bit like that one as well. And then finding the right person is a bit of a puzzle, because I've always had mentors and coaches, and then I've always have in some degree somewhere I could go and talk about, my soul, my struggles, and so on. Because again, it's not a business problem I'm solving. It's like it will impact my business if I'm not on top of myself and find out how I manage to live life at the best possible way with the constraints I have, or the challenges or obstacles I need to go through. Because as we have been talking about, when we've been talking, there's always obstacles to fight, either on health, finances, family members.
Family.
Yeah, there's so many constraints on you in today's world, and the pressures are huge, especially in. We will. I think the Dalai Lama said it very well. He said it's troubled times right now. So to
It
talk a
was
bit about.
much simpler. The times were much simpler 50, 60 years ago. Now with social media, I mean, yes, it connects people. It really does connect people, but it also presents a huge challenge with all this TikTok and, with this bullying, online bullying. It's really, there are two sides of the story. I mean, it can be really, you go to Instagram, you see all these happy moments. People just post their happy moments. But then for those who cannot really experience those happy moments, it's a source of depression, a source of loneliness. Why don't I have all these friends? Why don't I have this much fun? Why can't I afford to go to this beautiful restaurant in Rome? So it's like there is a two side of the story, and we really have to be conscious about it as humans. I really truly believe in that. So MeTime Healing provides guidance counseling, period. We used an algorithm that people can come in. They can put their, wants and needs. This is what I need. This is what I, have struggling with. And, they can pick the language that they want to speak. We have 10 different languages. Our providers are very diverse, and they can pick the age group. They can pick if they want, from an LGBTQ community, because they want to connect with the right person. So that first step, I think, is very important, because we really tried, when we designed the algorithm, to connect people with the right person. I think that's very important. And we pair them with 5 providers that have open calendars and speak that specific language that they're looking for. And they're trained to tackle those specific challenges that they are struggling with. So whether it's, couples therapy or addiction or, I don't know, time management for younger generation, the 18, 25-year-olds, they really are struggling with loneliness, time management, school, of course, college is very challenging. My son is 22 years old. Last year, 2 of his friends committed suicide. And these guys are, GW students, very, very accomplished students. Imagine, you work hard and you get into a nice college and suddenly you're lost. So you never know what the purpose, you never know what's, ticks people, but having these resources readily available, I think is very, very important. And, as the citizens of this world, we need to create more resources. We need to, really speak loudly about, these emotional challenges. There was 50 years ago, 60 years ago, nobody talked about mental health. Who talked about mental health? Nobody. And nobody talked about autism. Nobody talked about, special needs children. What can we do for special needs children? So with all the awareness that came in the last 10, 20 years, now we are, really laser focused on these specific issues. And I think it's for the betterment of the society. We're giving them all the tools and everything that they need. They can succeed. They can, reach for the stars. And this tool to me is that, I want to present something to those who really need guidance to reach for their stars, to reach their full potential.
And I guess also it's like I was thinking, I was preparing for this, and because everybody has been through pressures the last year, and it was quite funny. I did a session some time ago where I suddenly said, what is it that I think the question was something about what are you missing in life, and it's joy. Like this whole, like I think many people struggle to find the joy in all this because they feel the battle is so immense and the expectations are so immense. And then I could imagine being a young person now in the years 18 to 25. You just said, what a different world than when I grew up in the late 90s, and the pressure. I can't remember. I can remember you needed to go and get a job, but that was it, and there was not these extreme. There was no mobile. There was no smartphones yet, and the internet was just about to erupt. I can remember my first job was still sending fax. We have very little access to one email account. They're called info at.
Do you remember those printers? ...
Yeah, exactly. So actually, so as I can see, there's this need, and you can see when Dan Simons, which we both have a shared connection to, was talking about the importance of a CEO now needs to really be aware of mental health because it's probably always been there, but now it has a huge impact on the business if you are not driving it in a positive way. So how are you actually helping people to feel mentally safe at work, or how do you help them when they're down as well as up? But talk to me a bit about what is the mission of MeTime Healing? What is that you want to accomplish with it?
So our mission is to create, everybody has, I believe, a good mission. If you're going into this much work and if you're dedicating all this time, you have to have a mission, like something in you have, pushed you to do this. So initially my mission was to bring, to introduce a product that is international, it's global. And, our catchphrase is healing without borders. So MeTime Healing is really dedicated to bring a safe place, to introduce a safe place where people can come, open their hearts and find guidance and, start their healing journey. So, and we want to touch everyone. We want to, be present where people can easily access us. People can, set up their virtual settings within minutes, not hours, days, months. So, my goal is to have, providers that are ready immediately. Like, like there are pharmacies that are 24/7. So I want to have, that's my goal. We want to have 24/7 availability with, providers who are on call, just like doctors in emergency rooms that are on call. So when people really need guidance, they can be there for them. So that's my next goal. Right now, we are not 24/7. We require at least 2 days, heads up before we can give them an available appointment. And that's a requirement that comes from the providers. But we have the chatting platform that they can chat with our providers 24/7 and get guidance and continue discussions and the support that they really need immediately. That being said, MeTime Healing is a preventive platform. It's not for cases that are, needs to be referred to psychiatrists and, those who can handle more serious cases. So we are a preventive company. We try to prevent, situations that are, I would say, like emergency situations. Yeah.
Yeah, that's really interesting because, like, one of the things I remember from my conversation, we keep on coming back to Dan, but we talked a lot about how you prevent instead. How do you actually prevent actually people hitting rock bottom, and actually how do you help them before they do that? How do you give them tools to live the art of life, which is as you get older and you get kids, the complexity rises, it becomes harder and harder. Can you talk a bit about like typical who is using this platform? And because of course everyone can use the platform. That's the thing you just said, there's access to everyone. You try to get the cost down as much as possible, where everybody still has to make some kind of living out at it, as both as the provider of the consultancy or the help to the clients, and then and then also of course the business MeTime Healing also needs to make something to make it work and scale the proposition. But who is typical coming on here? Is it companies? Is it individuals? Who are you?
We have a good mix. We have a good mix. We can't track their age, of course, because it's a HIPAA violation to collect and share some information. But I can give you a general idea of we have users from 18 years old all the way up to 70. And, so it's not for children. That's for sure. We don't provide services to children, but we do provide services to emerging adults and older. I have great connections with primary care doctors that we work with. And, I have introduced our brand to them, and they refer their own patients who are struggling with emotional issues and mental health issues. They, come to our platform and they find their perfect match. And that's our goal, to provide the right resources to those who are in immediate need. But we're still trying to establish ourselves. Our product was launched last May. So we are coming to a full circle of our 365 days. Our 1 year is coming up. So I'm very proud of what we have achieved in such a short time, because this was developing in my mind for several years. And then I met with our, software engineers. We designed the idea, the algorithm, and we have, we're using AI in the background to, have our AI assistant, I would say, to, arrange, the algorithm in the background that, supports the platform. And once we launched, our goal was to, increase the number of our providers so we can give more options to our users. We started with 10 providers. Now we're almost 100 providers in our team. And I'm hoping by 2028, we'll have 500 providers in our team. So, we're growing rapidly. We're proud of our, everybody in our care team. And I single-handedly meet with them, interview them, and make sure that they will complement us and we will complement them. So it's very important to have the right blend of people in your team, because you need to work with them for long hours. So you have to really understand the mission of the company, and you really have to be passionate about that mission. So everyone in our platform understands what we are doing, who we are trying to reach, and why.
Yeah, and I think what's really interesting about it last time you told also that you just said I have an interview yourself, but also you're doing quite a vigorous what do you call it? Assessment of these people are actually able to deliver what they promise in principle.
Yeah. And, we are hearing now that, they have AI providing mental health support. There are so many new products coming out, and, we really need to be careful. I think artificial intelligence is a wonderful tool. It, helps facilitate a lot of things. But when it comes to mental health, we really need to have that human touch. I think it's very important for a human to connect with another human that knows what he or she is doing, and they can give you the right, formula. And, you really need to be able to look in their eyes and see if this person is, conscientious about what he or she is saying. Are they passionate? Are they empathetic? Are they, really believing in what they're saying? So, all of these, sensitivity chips are important. They need to be there. Otherwise, you won't see any solution. So I look for the right person to bring in my team. They have to have all those sensitivity chips to be part of my team, part of MeTime Healing. But
Yeah,
again, that being said, I'm just the soil. I just nurture my team. I'm not the sun shining on top of them. I just provide the platform. I just provide them this tool that they can reach out to the world, and they can, provide what they're trained. And my whole team has a master's degree in clinical psychology and at least 2 years of training and experience in the field. So that's very important to me. They have to have the right background and the credentials to join MeTime Healing platform.
Yeah, so you can join as an individual. You can also get your workplace. Can you talk, because lots of the listeners here are leading teams or might be thinking about like that, and how can I actually make sure that I either help people when they are on the way down, or how can I prevent my team comes there? Even your best performing person can hit the wall and just disappear off the lens. And I think most people have had that place where they say they reached rock bottom, or suddenly they got hit by that, from a left field, they got hit by totally lost of purpose, and because they just worked out or burned out, or then they talk about these clinical or pinnacle moments in their career where they make really big decision. They can be both be good, and they can also be really bad. Like people can make some really, or they can grab to addiction or whatever it is, because they didn't actually prevent that situation. But if I'm a leader and I thought this sounds like a great idea, I can make it available to my team, which is working on many different locations. They might be different countries, and now I can actually give them access to something, or help them getting access to something where I actually can proactive help. So how would it work for a company if they're approaching MeTime Healing and wanted to do some kind of collaboration and make it available?
Thank you for that question. Thank you for that question. Yes. So we do have a partnership page when you access MeTimeHealing.com. We have a dedicated page for our partners, so they can go and see who we have partnered with already, and their feedback, their testimonials are posted, and they can ask for a demo, and we will meet with them. My team and I, we will meet with them, and we can give them a demonstration of who we are, what we do, what's our purpose, what's our mission, and what values we will bring for their organization. And the idea is, for me, efficiency is very important. So everything about, our story is how we can efficiently provide resources for people, resources that, they really need as soon as possible. So, so our, with the demonstration part, with the demo, we will bring all the aspects of, how we can train your staff, how we can be present, how we can make this part of your employee, assistant program, or the perks that you offer. Some have 401ks, I don't know, health insurance, dental insurance, vision insurance. But I think mental health is also very essential, because that's the full human being. We don't only have physical problems. We have social problems. We have emotional problems. There's a lot of loneliness in the world. So it really affects the bottom line. When your employees are absent, they don't show up, they're late, it all adds up. And it's bad for the economy in general, not just your financials as an organization, but the economy in general. So, and this is not just I would say, an urban problem. Farmers have similar problems. Everybody's worried. Everybody has that, the thing, behind their mind saying, am I going to be okay tomorrow? And this really started after the pandemic. We learned to pause and listen to ourselves and say, well, what's my purpose in this life? Why am I here? Am I going to be okay tomorrow? Is my job secure? With AI coming, a lot of worries in big corporations. Am I going to have my job tomorrow? Am I going to be, able to provide for my family? So all these worrying feeds the human, psychology, and, what makes us us. So we have to wake up with a smile. We have to have a purpose. We have to count our blessings, and we have to, be productive and have a purpose in life when we wake up. So, our goal is to, provide that guiding path, a healing path for those who are lost on their journey, to bring them back to to their core, and say, provide the resources that they really need to get themselves on the right path.
It's very interesting. You talked about the people, companies partnering up with you. And what I think is brilliant by your side is that if you go on and you say there's actually free resources there, even if you just want to dip your toes in and you just need a bit of guidance out of stress or sleep management or whatever it is, there's like all these resources in there. And I dived into some of them and I thought they were pretty good. From that, actually, you just need to dip your toes in and try to understand what's actually going on with me. And you said something really interesting. I had Edward Hess on the podcast recently, Dr. Edward Hess, we're talking about AI. And actually what we talk about, this is the era where, there will be computers and machines that are smarter than you in a moment. Actually, your job is under threat. About 40 to 45% of jobs we know today is going to disappear and be done by the machines. IBM have been out saying about, I think it's about 65% of their back office is now run by machines. It's not humans that does, it's AI. And that means there's lots of these jobs that will disappear, and thereby there's people's livelihood that come under threat. And therefore, your job actually is going to be to become the best version of yourself. And therefore, to become the best version of self, there's lots of discovery and lots of things you need to unpack in a way. And therefore, your mental health and the employer's interest in helping people with having the best mental health possible becomes more evident than ever. Because that's really, if people are very good at building the best self version of themselves, that will translate into the performance of their work, because they're going to have to do other work that machines can't do.
Yeah. And I really appreciate podcasts that, talk about AI and the threat that AI, or, also the positive side of AI. And, but what makes your podcast very unique is, the hospitality industry, restaurant and hospitality industry is about human touch. Just like MeTime healing, you need that human touch. If you have AI cooking your meal, it's not going to be the same. You need those beautiful herbs. You need that pretty plate. You need that, when you go to a nice hotel, they put flowers on your bed. You come in, they have a champagne waiting for you, whatever. But you need that human touch. It's such an essential part of this life. And if we lose that, we're all going to be lonely. So we can't lose that. We can't afford to lose that. So we really do need to promote, the importance of human touch and the involvement of, what makes us unique, what makes us different than AI. And yes, AI is going to be there. It's the future of the planet. This is it. And we as humans need to be able to manage them well. We need to manage, we have to be very conscious about this and manage what we do with this wonderful resource. And like I said, I use it at MeTime Healing. We use it and it delivers perfectly, delivers what we have programmed to do. And but we wrote that, coding. So you really need to be very delicate when you're, feeding information and you're expecting results from artificial intelligence. And when it comes to mental health, it definitely is a no-no to me. You need to connect with a human. You have to have that, background, the experience, the education. All of these matter in the upbringing of any doctor, any provider, any all the I worked for I as I told you in private practice. The doctors that I work with, every one of them are unique. They all bring something new to the organization, something unique to the organization, which makes them special. And with mental health, it's the same. You have to have empathy. You have to have the drive and the care to connect with your client, to non-judgmentally understand your client and provide guidance. So I'm not really sure if an artificial intelligent, resource can do that. An AI can do that. I'm not sure.
No, I think, and again, I think hospitality's got to be hugely valuable, especially hospitality businesses that can deliver that human touch. And I'm thinking about many of the organization we have there on the show and the leaders they're really focusing on that. And that's actually going to be the positive thing around AI, actually, that there's going to be more time maybe to the positive touch in businesses, because all the other tasks that could be done, the more operational task, is done by the AI. But what do you see, what is your learning? You built this platform, you've been on this journeys in 2020 in principle. What has been some of the most significant learnings you've done around this and solving the problem around mental health?
Significant, I think, connecting with the right, connect through this journey, connecting with the right resources, using my background and my connections, the primary care doctors that I've been working with for the past 20 years, the organizations and the vendors that I've been, in touch with for the past 20 plus years. So I used my connections to design the end product. I wanted to understand, I wanted to really understand the challenges that are out there before we started coding the platform. We started, putting the idea together. So, for every industry, there is a different challenge. So, but just as, hospitality industry, the medical industry is going through a rough time. This country is not providing enough doctors. This country is not graduating enough nurses, psychiatrists, psychologists. So we are short in supply. So that to me was an alarming point in my life, that what do we need to do? So I realized that there really needs to be a global solution. We have to think about globalization, bring resources, bring doctors, which the United States already is doing. For years, they're bringing doctors from other countries, from China, from India, from Turkey, from Iran, and it's the only way, because it's a very challenging industry, if not as difficult as hospitality industry, but it is as challenging, I would say, as an industry. It's working with insurances, dealing with payments, billing. It's been so difficult and so challenging. For every little procedure that a doctor needs to do, they have to ask for pre-authorization from the insurances. So it has become very complex to do their job. So, to me, it needs to be less bureaucratic and more accessible. So that brought me to my journey with MeTime Healing. I wanted a more easily accessible resource that doesn't involve insurances, doesn't involve middleman, doesn't involve, all the, clutter. So it's just the user and the provider. You go in, you put your, requirements. If it's family issues, couples therapy, loneliness, time management, you just put it there, and within minutes, you're matched with 5 providers that can guide you through your healing journey. And our message is healing without borders. We want to reach everyone. We want to be able to be present for those who really need this resource. It's a great resource. That's why I'm here. I'm talking about it. I want to bring it to people's in front of them and have them experience it because it's it's a good product. We put our hearts and soul in it, and my team is a wonderful team, and I really truly believe that they are our core competency and they're my greatest assets.
As I was listening to it, it's like the interesting thing is like, and care is definitely also a very, very difficult place. I think no matter where you go in the world, care medical area is as difficult as hospitality because again, it's driven by the human touch, and when you're under resourced, it becomes there's the consequences in the experience when you go to the restaurant, the experience when you go to the hospital, and you see that in different countries, and I'm between two countries in Europe, the UK where I live, and then when I'm back home visiting Denmark, and I experience, sacrifices in both places. And Denmark is actually normally a place where there's very high. I still think there's a very high service, but it's under pressure, as you say. It's really interesting how you thought about that, and taking those learnings from your network into the product solution and use that as a founder to solve the problem on a global level. I really like that. How do you yourself show up in the best version of yourself every day? Because you're working with mental health, and I guess that when you have it at your fingertips, you would think, you know, that's a person that knows what to do. But how do you do it? How do you show up as the best version? How do you succeed every day?
Well, I have a routine. I meditate as soon as I wake up. I meditate. It grounds me. It you know makes me understand what's important and what's the purpose of my day. So why am I waking up today? So it really gives me the fuel that I need.
Mm.
And just like you, I love books. I love poetry. I wanted to share this. This is one of my favorite poets, Rumi,
Yeah.
Persian poet Rumi. So the wealth of information that's out there through books, through poetry, through nature, I tap into it. I take walks. I connect with flowers, connect with trees. I smell it, I hear it, I touch it, I read it. So everything that's around me is there for a reason. So
Mm.
I take advantage of that.
I love the bit about, you started out talking about nature as well, and actually there's obviously a lot of healing spending time outdoor. Now spring is coming, and it's been here in the UK at least, it's been a cold and wet winter, and even though I've been out, it's like it's really important that to spend time, even if it's raining, just get outside for your mental health in a way. I think it's one of the best way to heal sometimes, and without anything, I normally say, without a podcast, without anything in your ears, get out in nature, walk, run, whatever you can do, and actually just listening to what's going on, the leaves or the grass or whatever it is, because it's so healing in itself. It's as effective as meditation, and it's a different way of meditating. I love that. What is the one question you wished I asked you in today's conversation, and what would the question be, and what is your answer?
Yes. I wanted to talk about my team.
Mm.
And, we did talk about me, but I really don't want to be the center of attention. I'm actually very shy. And until probably a couple of years ago, I didn't even have a LinkedIn profile. And, I'm kind of learning to put myself out there to promote my brand, to promote this wonderful product. But, therefore, I want to talk about my team,
Mm.
and bring them to the light, shine the light on them. They are the product. They are the brains behind this product, and providing the supervision, the training that they have, the intelligence that they bring into this product, makes us who we are. And I really do want to shine, the light on them, and telling our users to go and experience it, because after one session, they're gonna really understand that how truly dedicated each one of them are, how truly believe in what they do, and how empathetic and compassionate they are. So, and as I said, I interview every one of them myself. I try to find the right candidate who will complement us as much as we complement them. And creating this team, this care team, was very important to me. And bringing the positive energy, everyone that has a positive energy, who has dedicated their life, to this. It's their purpose to do this job, and it's it's a great resource to cultivate and bring together and present to a global platform, and I'm very proud of that.
I love that. I love that. That actually you. Of course, I should have asked you what about the team that makes it happen, because that's what Hospitality Mavericks is all about. So that's a very good question. Can you let people know where should they go if they want to learn more about MeTime Healing or want to connect with you? What is the best place to do it at?
So MeTimeHealing.com is our domain. So www.metimehealing.com. In one word. We have a LinkedIn page. We have a YouTube page. We are on social media, Instagram, at MeTime Healing LLC, Facebook, and we have live sessions. We just had one on Wednesday, where our providers come and talk about specific challenges. Our recent one was about mindful eating, which is very related to hospitality world. So I would suggest, for you to go and listen. It's just 30 minutes. Sorry about that. Can you hear me? Yeah. So we try to keep it short, because we know everybody has busy schedules. So we also have, live sessions on LinkedIn, where again we share our story, what we do, who we are, the resources that we provide for our clients, and that's for enterprise solutions. So Instagram is more for users that are B2C, and then LinkedIn is B2B. So we try to talk about relatable topics that people can take advantage of. So next month is Mental Health Awareness Month. May is Mental Health Awareness Month. So we'll be talking about that. And again, it's our anniversary. So we're very proud of, our journey. It's been a wonderful year where we learned from each other, and we grew as a brand. And, we will continue to present ourselves to those who are in their own journey for discovery and in their own healing journey. So, yeah.
Thank you so much, Feri, for coming on the show, sharing the journey with us, and also giving some guidance of where there's help to be given. I send you and the team power and energy to continue doing the important work you're doing to improve and prevent mental health challenges.
Thank you so much for inviting me. It was fun. I enjoyed talking to you.